The muscles that act on the hand can be divided into two groups, the extrinsic muscles and the intrinsic muscles. The extrinsic muscles are located in the anterior and posterior compartments of the forearm. They control crude movements and produce a forceful grip. The intrinsic muscles are located within the hand itself. They are responsible for the fine motor functions of the hand. They include the thenar muscles, hypothenar muscles, the lumbricals, the interossi, and other muscles. In this video, we will be focusing on the intrinsic muscles of the hand, as we have already discussed the extrinsic muscles. We will discuss their attachments, actions, and nerve supply. Grab a seat and enjoy. Let's start with the thenar muscles. The thenar muscles are three short muscles that are situated at the base of the thumb. The muscle bellies produce a bulge that is known as the thenar eminence. They are responsible for the fine movements of the thumb. They include the opponens pollicis, the abductor pollicis brevis, and the flexor pollicis brevis. The nerve supply to these muscles is by the median nerve. Let's take the thenar muscles one after the other. We will begin with the opponens pollicis. The opponens pollicis is the largest of the thenar muscles. It lies under the other two. It originates from the tubercle of the trapezium and the associated flexor retinaculum, and inserts on the lateral margin of the first metacarpal. Actions of this muscle include opposing the thumb by medial rotation and flexing the metacarpal on the trapezium. Like we stated before now, the thenar muscles are innervated by the median nerve. It is the recurrent branch of the median nerve that innervates this muscle. The abductor pollicis brevis is another thenar muscle that forms the anterolateral aspect of the thenar eminence. It overlies the opponens pollicis. This muscle originates from the tubercles of the scaphoid and trapezium and from the associated flexor retinaculum. It inserts at the lateral side of the proximal phalanx of the thumb. Action of this muscle is that it abducts the thumb. The nerve supply is still by the median nerve, precisely by the recurrent branch. The flexor pollicis brevis is the third thenar muscle, which forms the medial aspect of the thenar eminence. It has a superficial and deep part, although the deep component is variable in size. This muscle originates from the tubercle of the trapezium and from the associated flexor retinaculum. It inserts at the base of the proximal phalanx of the thumb. Action by this muscle is that it flexes the metacarpophalangeal joint of the thumb. The nerve supply is also by the recurrent branch of the median nerve, but the deep head of this muscle is innervated by the deep branch of the ulnar nerve. Let's look at the hypothenar muscle. The hypothenar muscles form the hypothenar eminence, just as the thenar muscles give rise to the thenar eminence. The hypothenar eminence is a muscular protrusion on the medial side of the palm at the base of the little finger. These muscles are similar to the thenar muscles in both name and organization. They include the opponens digiti minimi, the abductor digiti minimi, and flexor digiti minimi brevis. These muscles are innervated by the ulnar nerve. Let's take them one after the other. Firstly, the opponens digiti minimi. The opponens digiti minimi lies deep to the other hypothenar muscles. It originates from the hook of the hamate and associated flexor retinaculum to insert into the medial margin of metacarpal 5. The action of this muscle is that it rotates the metacarpal of the little finger towards the palm, producing opposition. Just like we stated, the ulnar nerve is responsible for the nerve supply of this muscle. The next hypothenar muscle is the abductor digiti minimi. The abductor digiti minimi is the most superficial of the hypothenar muscle group. It originates from the pisiform and the tendon of the flexor carpi ulnaris and inserts at the base of the proximal phalanx of the little finger. The action of this muscle is that it abducts the little finger. The nerve supply remains the ulnar nerve. The last hypothenar muscle is the flexor digiti minimi brevis. It lies laterally to the abductor digiti minimi. This muscle originates from the hook of the hamate and adjacent flexor retinaculum. It then inserts into the base of the proximal phalanx of the little finger. The action is that it flexes the metacarpophalangeal joint of the little finger. It is also innervated by the ulnar nerve. The next on the list of intrinsic muscles of the hand are the lumbricals. There are 4 lumbricals in the hand. Each of them is associated with a finger. They are very important for finger movement, linking the extensor tendons to the flexor tendons. Loss of nerve supply to these muscles is what brings about the ulnar clawed fingers and hand of benediction. Each lumbrical originates from a tendon of the flexor digitorum profundus. They pass dorsally and laterally around each finger and insert into the extensor hood. Actions of the lumbricals include flexion at the metacarpophalangeal joint and extension at the interphalangeal joints of each digit. The nerve supply to the lumbricals is coming from the median and also the ulnar nerve. The lateral two lumbricals of the index and middle fingers are innervated by the median nerve, while the medial two lumbricals of the little and ring fingers are innervated by the ulnar nerve. The interossi muscles, which are also among the intrinsic muscles of the hand, are located between the metacarpal bones of the hand. They can be divided into two groups, dorsal and palmar groups. The dorsal interossi are responsible for the abduction of the fingers, while the palmar interossi are responsible for the adduction of the fingers. In addition to their actions of abduction and adduction of the fingers, the interossi also assist the lumbricals in flexion at the metacarpophalangeal joints and extension at the interphalangeal joints. Let's take this group of interossi one after the other. Firstly, we go with the dorsal interossi. The dorsal interossi are the most superficial of all dorsal muscles, and they can be palpated on the dorsum of the hand. There are 4 dorsal interossi muscles. Each interosse originates from the lateral and medial surfaces of the metacarpals. They insert into the extensor hood and proximal phalanx of each finger. Actions of the dorsal interossi, like we stated earlier, are abduction of the fingers. They also assist in flexion at the metacarpophalangeal joints and extension at the interphalangeal joints. Their nerve supply is by the ulnar nerve. As for the palmar interossi, they are located anteriorly on the hand. There are 3 palmar interossi muscles, although some experts describe the 4th muscle as being at the base of the proximal phalanx of the thumb. Each palmar interossi originates from a medial or lateral surface of a metacarpal and inserts into the extensor hood and proximal phalanx of the same finger. The action of these muscles, as we also stated, is adduction of the digits. They also assist in flexion at the metacarpophalangeal joints and extension at the interphalangeal joints. Nerve supply is also by the ulnar nerve. There are still other muscles in the palm that are not lumbricals or interossi and do not fit in the hypothenar or thenar compartments. There are 2 of them, actually. The palmaris brevis and the adductor pollicis. The palmaris brevis is a small, thin muscle found superficially in the subcutaneous tissue of the hypothenar eminence. It originates from the palmar aponeurosis and flexor retinaculum and attaches at the dermis of the skin on the medial margin of the hand. Actions of this muscle comprise of wrinkling of the skin of the hypothenar eminence and deepening of the curvature of the hand, thereby improving grip. It is innervated by the ulnar nerve. The adductor pollicis is a large triangular muscle with 2 heads. The radial artery passes anteriorly through the space between the 2 heads, forming the deep palmar arch. One head originates from metacarpal 3, the other head originates from the capitate and adjacent areas of metacarpals 2 and 3. Both attached to the base of the proximal phalanx of the thumb. The action of this muscle is that it serves as an adductor of the thumb. Nerve supply is by the ulnar nerve. Alright friends, support Joe and Academy by subscribing to this page. Don't forget to like and share. We will see you next time.